We begin with the tantalising prospect that some national COVID-19 restrictions will soon be eased. Chief Medical Officer Professor Brendan Murphy says we might soon sit on a park bench or even have a mate over for a visit. I spoke to Professor Murphy a short time ago. Professor Murphy, thank you for your time. Health Minister Greg Hunt has just tweeted that 1.9 million people have downloaded the tracking app, which is pretty extraordinary, isn't it?
It's a great result, Tracy, and I'm not surprised in many ways because I know how Australians have risen to the challenge in dealing with this virus, and I think they trust that what we've said is true, that it's only going to be used for public health purposes.
How many people, you've indicated you'd need about 40% of, I guess, mobile phone users to download it for it to be effective. How many people does that translate to you,
Yeah, I think it's useful however many people take it up. So even the 1.9 million we've got now, that's 1.9 million people that will be helped if they're in contact with a positive case. So every single person who downloads the app helps. Now, it obviously gets more and more value the more people that have it. And the number of 40% came from the Singapore modelling that suggested that it would be really game-changing at that sort of level. But we know that just having it for even a relatively small proportion of the population will be a fantastic advance, and we've already got a significant proportion. Our target is particularly adults because they're the ones that transmit the virus, and the mobile adults with mobile phones. So the more we get, the better. What's
optimum? What's the optimum number? Is it 5 million?
We haven't really modelled that. The more we get, the better it is. It is only a tool to aid what's already happening in the public health units across the country.
You said something at today's briefing that I hadn't heard before. You said that it's young adults who are transmitting this virus. Mm-hmm. What age group? I mean, I didn't know that you knew, that you drilled down and you knew that kind of detail.
The highest group of COVID-19 infections in Australia is in the 20 to 29-year-olds, and then the 30-year-olds and the 40-year-olds are also pretty high. So they're the people who are getting the virus. They're also the mobile people, and they're usually the contacts we've got. So they're the people we're really keen to download this app.
And are they transmitting because they're super spreaders, because they're shedding more virus, or are they transmitting because they're not in a high-risk group and so they're more careless about social distancing?
Well, I think they're the ones who have the most frequency of the virus. They're the ones who've got the infections most, and they're also spreading because they're usually very mildly symptomatic. Young people who get this virus often just have a mild cold, so they're not like an older person who can often get quite sick and be in hospital or stay at home. They are mobile and moving around, and we've seen some of them have gone to work not realising that they were transmitting the virus because they had mild symptoms.
And that's why you have to start switching your testing to asymptomatic people. That's driven it, has it?
Well, we don't know quite how much asymptomatic carriage there is. We don't know whether people who have asymptomatic infections are transmitting, but we need to, if we're going to release restrictions, we have to test more broadly. We've already broadened the testing to every single person with acute respiratory symptoms. Anyone with a cough or a cold or a runny nose can now get tested. That's a big expansion. But now we also want to test a selection of the community who are well, just to be sure that we're not finding significant amounts of asymptomatic infection.
I want to talk to you further about the sort of carrot and stick approach, if you like, to downloading this app. The stick is that we have to download an app that tracks our movements. The carrot is what's in it for us. And I'd like to explore with you what will be in it for us in terms of freeing our movements if you're more confident of your ability to trace us.
Sure. So I should correct you, it does not track your movements. All it does is record when you've been in contact with someone and their mobile phone. It doesn't say where you are or where you were at what time. That's really important because some people are very frightened about that. It just gives the public health worker the phone number of someone who was sometime on and the date where they were in contact with you for more than 15 minutes. But the trade-off, as you rightly say, the more confidence that we can give the National Cabinet, the health experts, that we have the world's best public health system, the more likely they are to want to gently and cautiously release restrictions.
So what might that freeing up look like? And let me give you some examples, because from this weekend, for example, Queenslanders are going to be allowed to have a mate-over, which just seems like such a treat. Western Australia will be able to have a gathering. Northern Territory national parks are going to reopen. Might that become more uniform for all of the states in 2 or 3 weeks?
Yes, correct. Yeah.
That's what you're looking at?
Correct. Gentle restriction that's safe and monitored so that we don't get those big community outbreaks which nobody wants.
So we'd be able potentially all around the country to sit on a park bench with a friend, possibly?
Quite possibly, Tracy. I don't want to preempt the decision of the National Cabinet, but certainly there's a reasonable likelihood of that.
I can't tell you how excited I'm getting about it. What would need to happen for restaurants and pubs to reopen? I mean, I know this is a hypothetical and that's not what you're looking at next, but would we need to have no new cases in Australia for 2 weeks, for example? Is that what you need? No,
just good, solid control. But if earlier relaxations were not accompanied by further outbreaks and we were still under good control, and a period of time had elapsed where we could be sure that measures that had already been taken hadn't had an adverse effect, because it takes about 2 weeks for any measure to have an impact. And at the moment, the most important thing for us at the moment is to get kids back to school. And that in itself, we need to monitor any other relaxations that might happen in a few weeks. And then the National Cabinet, would be wanting to look at things, 2 to 4 weeks after that, and to reassess what's happening. Things
like restaurants and pubs, or is that months down the track?
It's too early to tell. I mean, you could imagine potentially small numbers of people in a socially distant way in a restaurant. I think pubs and clubs are a bit more problematic, but the people are thinking about things in very different ways. I think I said in my press conference today that there are some things we will permanently do the same from now on, like hand hygiene. We're changing some of our basic human interactions.
Yes, you did say today that social distancing, people would need to change how we interact permanently. What do you mean by permanently? Do you mean until we get a vaccine, or do you mean forever?
Well, some things forever. I think hand hygiene is here forever. I don't think people will treat their hands the same way ever in the future. I think we will all be washing our hands using hand disinfectant, because that's the right thing to do. We should have been doing it beforehand. We may even be less inclined to hop in very crowded lifts and things in the future, but clearly there are some things that are only going to happen, the true social distancing measures, we only need to do those until this virus is out of our lives, whether it's by a vaccine or whatever, or any other way.
I wanted to do this. Here's another hypothetical, and I know that I'm leaping ahead once again here, but airlines like Qantas are not going to be able to hibernate their international businesses indefinitely. And I know that, it's been canvassed whether we might be able to fly between here and New Zealand. But, their big hubs are in the UK and in the US and in Europe. How might that be able to resume, and when might that be able to resume if there's no vaccine? I mean, does the 2-week quarantine just happen for anyone who flies back into the country?
At the moment, that we don't see any way we could change the quarantine requirements, because you've seen the number of cases in most of those countries. Now, obviously, as the epidemiology changes in those countries, or if we get a vaccine, and there's still a huge amount of work being done on a vaccine. At the moment, we're looking, the next 3 or 4 months, and then we'll review what's happening. It's really, I don't want to be crystal ball gazing. At the moment, our priority is to keep Australians safe and to let us return to as much normal life as possible and safe to do.
Okay, a couple of other quick issues. President Donald Trump wanted last week to look into injecting us with disinfectant or UV light to kill the virus.
Is there any scientific basis to either of these propositions?
I would caution against the injection of disinfection. They could be quite toxic to people. I wasn't privy to his comments.
Do you wish someone had given you a heads up about what he had said before you were caught by it in that briefing?
Yeah, well, I was a bit blindsided, yes. It was an interesting experience. I understand that he said he was being sarcastic and wasn't being serious, which is very, very good to hear, because, as I said at the time, we certainly wouldn't want to encourage anyone to inject disinfectant.
I thought it was a golden moment, frankly. And one final question. Tasmanian police have found no evidence of an illegal dinner party of health workers contributing to that northwest hospital cluster. I know you're a very measured man and you're juggling a big job, but I bet it plagues you that that rumour even made it to your desk.
Of course it does. Of course it does. It plagues me even more that what I thought was an in-camera discussion with a parliamentary committee was in the public domain. But I, you make a mistake and you retract, and I'm very, very pleased that there was no such event. Makes me very happy.
OK, don't hang on to it for too long because you're doing a great job. Thank you. Good to talk with you.
Thank you. Thank you.
Chief Medical Officer Professor Brendan Murphy.